And one thing to keep an eye on is the infection rate of the states that are reopening. As you can see here, Georgia, which was one of the first to open, is seeing a more than 50% increase in reported cases since it reopened 2 weeks ago. And with that in mind, let's bring in Dr. Cameron Wolfe, an infectious disease specialist at Duke University's Medical School. That hospital there has treated more than 250 COVID-19 patients. North Carolina beginning a phased reopening today. Doctor, welcome. Good to have you with us. I note that new cases in North Carolina on Thursday were 639, the most ever, and yet the state is reopening. I didn't think it was supposed to work that way.
Well, I think thank you for having me on for a start. I think if it's going to reopen, the way we've approached this is that it's got to be particularly cautiously. You know, we're a hospital that, fortunately, compared to some of the states up north, have not been hit as badly as, for example, New York or Michigan or colleagues in Emory, as you just discussed, in Georgia. But it's been busy for us, and so I think we're very conscious of the way that our state is trying to open up and trying to be as cautious about that as possible to allow us to handle that. But at the same time, we're in a place where we recognize we don't just care for the health of our community. We also care for the economic well-being of the people who work here and are in our town and district. So we're going to try and work with our state to make that as effective as possible.
But back to the point, I thought cases were supposed to start coming down and be coming down for a period of days, along with hospitalizations, fatalities, and intubations before states went on the course to reopen. And this seems to fly in the face of that. Now, it could be simply that the testing is getting more prevalent and therefore more cases are showing up.
Yeah, we're certainly doing a better job here in terms of sort of liberalizing the amount of tests that we can do. I will say that on the inpatient side of the hospital, we're actually seeing a diminishing number of admissions here, at least. You know, typical of most states, that's been a little bit regionalized depending on where in the state you would be. But certainly for us here in the Triangle, it's not been as busy in the last 1 to 2 weeks as it had been sort of mid to late April. So I do think things I wouldn't say they've eased off. They may have plateaued a little bit, in answer to your question. But still, we need to be cautious.
Yeah, maybe the curve has flattened a little bit. I see in my notes that you were involved in one of the very first tests of the antiviral Remdesivir in the treatment regimen for COVID-19. And I wonder how encouraging you feel about that drug's possible or really current use in treating patients.
Yeah, I mean, we've been very encouraged by it, to be honest. I mean, it was pleasing to not only see the effort that a lot of people here did to try and get that study up and running, but to then get a positive result to say that it is clearly better than standard of care was extremely pleasing. You know, I think there's going to unfortunately be a continued number of patients who end up on the severe end of the disease related to COVID, and so to have an option that's now available to them is a big deal. You know, we saw people improve on that trial, and that's been, you know, statistically shown, as Fauci announced last week. It's not the panacea drug. It's not by any means effective for everyone, but it sure helps. And I think if we can use that as a stepping stone to now continue to sort of move those studies on a little bit further and try and prove if we can even make it better, then I think we'll be in a good place. But it's a good start.
I want to come back to the question of how quickly the states are reopening and get from your medical perspective and that of colleagues with whom you've no doubt discussed this question. Do you think that states are moving at the right pace, too fast, too slow to reopen, given what you're seeing in the hospital and given what you know about this deadly virus? Too fast, too slow, about right?
I think it's probably a state-by-state answer to that. I'd be nervous looking at Georgia's figures there of an increase of 44%. I think it's not just a reopening question. It's a question of how you do that and how you look at the data that you get in the period of time after that to then adjust again. And I think if you had locked yourself into a reopening pattern, irrespective of what happened in terms of your case volume as you started to do that, then that would be too soon. And yet I think if you can phase that in a way that's analytic, in a way that's methodical, stepwise, and ultimately data-driven, then I do think you can slowly reopen. It's also about other mitigation strategies. So it's not just sort of, we think about reopening as a broad term that the shops are just going to suddenly open their doors. But if you can do that in a way that still encourages social distancing, that actually liberalizes and encourages mask wearing, that we're suddenly much more conscious of things like hand washing than we perhaps would have been a few months ago, then I do think you can be more cautious about the way you reopen and do it safely.
Mm-hmm.
But it's got to be data-driven. You've got to look at your numbers, and you've got to look at your hospitals, and you've got to look at whether they're seeing a second surge, and be prepared to slow down your reopening if you see that your numbers are re-increasing.